Hello, good evening to all the viewers who are watching live and who is watching as the recorded version. Also, at any time, who will be watching it right now. So, very much thank you for joining and getting your time to see this video and also the live stream. And if you do enjoy it, do make sure to like it. And so, without wasting any more time, so let's start our today's CME with the 30 seconds countdown time as usual.
Good evening, everybody. Good evening, sir.
Very good evening to all of you.
And today we are going to start our 37th live online CME organized by National Institute of Homeopathy Alumni Association. So we are already not pan India, we are present all over the globe. And today I am proud to announce that today's inaugurator is from Sri Lanka, our own alumnus of 21st batch BHMS, and she is the secretary of Sri Lankan Graduate Homeopathic Doctors Association, Dr. Upeksha Nandesani. With your permission, sir, I'll request Upeksha to inaugurate today's program.
Sure. Welcome,
Good
Upeksha.
evening. Thank you, sir. Good evening, Kalyani, sir.
Good evening.
A very good evening to all of you. I warmly welcome all of you to the 37th online CME session today. Our distinguished speakers are Dr. Arinjit Chattopadhyay, BHMS Cal, MD, Homeopathic Medical Officer, Government of West Bengal, ex-lecturer, Materia Medica, BV Homeopathic Medical College and Hospital Saintia, who will be speaking about various ways of approaching the remedy of a case. Then we have Dr. P.R. Datta, Deep NIH BSc DMS, a consultant homeopathic doctor having a 41 years of experience, a visiting physician at Dishani Hospital, Chandannagar, and as a community physician, he works at a State Bank of India. He's the only physician who works like that. And then he's a speaker in Homeopathic Medical Association. Dr. P.R. Datta will be representing acute cases in relationship with COVID-19. And we have our very own Dr. Ujjal Mandal sir, the Deputy Medical Superintendent of NIH, who will be a moderator for the tonight's session. I'm handing the mic to the Ujjal Mandal sir.
Welcome to NIH Alumni Digital Platform. So today's lecture, Dr. Pradip Datta, probably he is senior to me. So hope today's discussion will be very fruitful to all those are listening this program and viewing this program. I also welcome to Dr. Arinjit Chattopadhyay. He was our ex-PG students of NIH. He's a very good student. Hope he will give his good lecture on this subject. So without delay, let Dr. Datta, you please start your session.
Okay, thanks to all my listeners and also Narayan Kalyani. He is also my colleague during the DMS session, Narayan Kalyani. Both of us very much close to each other. However, nowadays we are very much worried, worried about the COVID-19. But truly speaking, it's a viral disease and most acute disease. If we consider the practice of medicine, we will see that COVID is a new type, though I have some doubt over it, whether it is new or old one. I don't like to go to any controversy over it, yet it is now become a pandemic throughout the world. And nobody or no nation has able to control it very clearly. One day they have placed one theory, next day they have changed. Whatever it may be, the COVID is a infectious disease, and this disease has been diagnosed December 1920 or 19, 2019. Whatever it may be, this is the WHO has um, designated as SARS-2, that is severe acute respiratory syndrome. That is, syndrome means compositions of different problems within the body, and its main target organ is lungs. And you know, or everybody knows, is that lungs has the uh, place, or lungs is the place of oxygen exchange area. If lungs is affected or lungs is not functioning properly, then every person will be the sufferer of respiratory distress. And in our daily life or practicing life, we have seen that most of the persons are being affected by the lungs ultimately. But why lungs affected? If we consider the total physiology, then it will be very clear to us that last stage of affected area is lungs. But first, there will be the sneezing, rhinitis, fever, headache. There may be anosmia, that is loss of smell, loss of appetite. If a person or subject become conscious about these problems, he may conquer his total ailment. That is, if he notice that he is suffering from first rhinorrhea, that is rhinitis. Then, if he become conscious about his ailments, then no problem. Ultimately, what we see that nobody care for simple ailments. We have become conscious about ourselves when it has become grave. That is, when we feel some respiratory distress. Already 2 to 3 days gone. What we see in influenza, actually, what I see or I say that COVID is the elder brother or eldest brother of influenza. In influenza, what we see that malaise, fever, body aching, same problems or same ailments would be seen in case of COVID also. But what peculiar is in COVID, there will be loss of loss of smell of food with diarrhea. In influenza, it may or may not be seen. If we consider these symptoms, we may take the medicines. But what we do, we are actually first at the very first stage, we are neglecting these ailments and taking the medicine by self, not consult with the doctor. Even doctor may also may misguided, misguided by self. So question is why the persons are become so victim. Actually, what I have said earlier, that if we consider our total ailments, whatever the disease may be, then we may be free from the disease by proper application of medicines. Suppose a patient has come, or better to say, I have seen during last 2 years, patients are coming with all the symptoms what I have said earlier. I have seen they have cured very nicely, and with proper investigation it has been recorded with me. Now, if a person come, no need to touch with him, no need to touch him. We can assess his body temperature by thermal gun. Then we may see his oxygen level concentration. If it goes below the 95, then oxygen supply is needed for him. If there is a negligency, then it may be the dangerous to the subject. And most of the cases what I have seen, that patients are very much reluctant with these symptoms. Even I have seen that some respiratory diseases are there. They thought that they had been the victim of COVID, which may not be. Now, if we consider our master's view, what he has said, and what the funny thing to us, that long before 250 years, what our master said, and what he has the intuition that these types of diseases are there. Nowadays, what we are seeing, that acute disease, and most funny thing is, we are actually living in so many unknown diseases. Now forget it. Now come to the COVID and acute diseases in relation with it. If there is any COVID patient, we must supply oxygen when there is oxygen level concentration below the 95. Apart from our medicines, isolation is needed there, complete isolation. Nobody will touch it. Along with it, it should be kept in mind that it is very, very, very contagious disease. That is infectious disease. So, if we want to get rid of this disease, we must maintain some. Suppose, whenever we come from outside, we remove our clothes to outside. 2 or 3 years back, we actually do not do this. But at now it is. Why? As because we are very much afraid of this disease. It may settle in our clothes, it may settle our skin. So, first, to maintain our physique, we have to do, or we have to be precautioned, or we have to be cleared ourselves. First, leaving clothes outside, wash our face with soaps, nose, eyes also. Nose means we have to clean with the soap both the nostrils, because these viruses first takes the shelter in the mucosal membrane, which are very much exposed to the air or outside. So in our mucosal layer is also in the mouth, but it is in general it is closed by our lips. But eyes and nostrils are open always. In ear, there is no mucosal layer. So we are not bothered about the ear. But we are very much conscious, we should be conscious about our eyes and nose. So it should be cleared. Eyes should be cleared by cold water. Nose should be cleared by soaps, moist soaps, insert into the both nostrils, clean it, the cold water, both hands, palms, foots, then enter into the room. If there is any problem, so we have to follow that problem means if there is any sufferer, mild sufferer, so he should be, or severe sufferer also, he should be isolated from the general mass. He should be isolated in another room, closed room. Closed means open. It should be open, but no mosquito, no flies will be there. He should be taken, or he should be supplied by some liquid, mainly liquid, that is milk, juice foods, soft diets, etc. Moreover, if there, as because it is now become pandemic, we must have to conscious about the physical distance. I have some objection that so many posters I have seen maintain physical distance and social distance, but it is not the social distance. It should be the physical distance. Physical distance means try to maintain the 3 feet. That's 3 feet distance. Use always sanitization whenever we will be in outside. Now come to the homeopathy point of view. Master, what I've said from earlier, that Master has said 250 years back that there are so many diseases which will come suddenly, stayed within the body for a moment, and it will be out either death or proper medication. Medication means, according to the homeopathy, medications means those medicines which have the morbific activity in the similar in the healthy body during drug proving. That types of diseases, that types of medicines we have to apply. Tell you very frankly, sometimes we have heard that arsenic album is arsenic album 30 may be the prophylactic medicines, but I have some controversy over it. In homeopathy, there is no prophylactic, there is no scope. Though we are using and we are getting sometimes good result, but forget the prophylactic, select the our acute medicines according to the Matria Medica and also following the organ of medicines. Suppose a person has come to me or come to anybody else with a body ache, with cough, slight loss of smell. And along with it, I must say, there are so many times we have lost our smell. We never bother for COVID. But at the very present moment, we are very much cautious about the loss of smell, as because COVID is our total area. Now come to the next. A person has come to me with a cough, with a respiratory distress, sudden respiratory distress. He cannot takes his or her respiration properly and getting relief, bending forward, sitting on the bed, bending forward. First, less but frequently, we must select arsenic. No question about it. On the other hand, if we see a person has the typical sneezing, rhinitis, malaise, headache, anosmia, we can think of Upeksha. We can think several drugs are there. A few days back, I have treated both son and his mother. And also one my receptionist at Chandannagar, typical arsenic picture I have got. Mentally restless, fear of death. So, sorry. So why should I think the other pathology treatment? Then and there we switch over. And in my practice, what I have seen after completion, after the recovery, not cure, I have given them influenzinum 200 two doses, and after that, Withenia somnifera mother tincture, because there is loss of vital strength during its course, as because all the viral diseases causing the typical malaise in the body. So, Withenia somnifera will help you. Prior to it, arsenic. Prior to it, systemic drugs according to symptom similarity. So, if we consider the disease as a whole, as a patient, then nothing to be worried. A few days back, I have listened one topics from AIMS, Dr. something Singh, A. Singh. He very clearly told that forget the disease, forget the name of the disease, treat the patient accordingly. That is, I have become very much pleased because his views and our master's views become the same. Why should we think about the name of the disease? We must treat the patient. Dear friends, every person has the different threshold level in the body. So, if there is any threshold, different threshold level, so X may be applicable to 1, Y must be applicable to 2, but A won't be the common to all. What we are seeing in our another pathy. The COVID has the most given lesson that COVID may be restored or COVID may be annihilated by integrated approach of treatment. Now, the question of preventive measure. According to PSM Act, everybody has to be prevented by some social medicine. Though it is not very hard to our country, in other country there is PSM Act also that everybody has to take the prophylactic measure, that is vaccination. In our state, in our country, it is now adopted and we have to take. Most peculiar thing is now, if you can testify yourself that whether there is any immunity process has been developed or not, then another test has already come. That is SARS-CoV-2. Name of the investigation is SARS-CoV-2 antibody quantitative test for development after 2 weeks of vaccination. You can justify yourself whether you have been rightly immunized or not. And if there is any person who haven't taken the medicine or vaccination, not vaccinated, then he can also be testify himself or herself by that test SARS-CoV-2 antibody quantitative tests after 4 weeks exposure of infection. So now it has been now very easy whether we have been immunized properly or we have been gained the herd immunity. So we have got the weapons also. Above all, I must say, being the homeopath, please don't be worried about the name of the disease. Go or cross the pavement with our own weapons. There are so many questions may arise, whether it is scientific or not. Dear friends, what is science? To know the subject very clearly is the science. So we have, whenever we are seeing that a patient is getting benefit from one pathy, so why should we not respect to it? It may be even there are so many traditional treatment also. If a person get benefit from one judicious treatment by one pathy, why we should not be bowed down our head to that pathy? First, observation. Then comes to the clarification or experiment. Experiment never gives always the exact result within a very few short time. And within a few days back or very recently, we are seeing that COVID is coming in another fashion. It is become muted, and its nature is, again I am talking about the COVID, that it is mutated very quickly, and virus has such tendency also. It is the character of any virus that it become the mutate very quickly. If we go through the cell division, then what we will see? There is two types of cell division. And this uh, virus very quickly muted itself and forming another form with a virulence character. So what we do? We do always go or move forward with our weapons. No need to see its experimental feature. No need to see its pathogenicity. We only see its result. If anybody challenge ourselves, we can easily establish that we are the conqueror of COVID along with or with the help of our homeopathy medicine by this experiment, that is SARS-CoV-2 antibody quantitative tests. Who has been, who was the sufferer and has taken our medicines after 2 weeks of vaccination or after 2 weeks of vaccination, we can exposure after 4 weeks. A person has been exposed easily, he or she can show himself or herself by that test. So, if we go through our organ of medicine, that is, every pathy has its own philosophy. If we go through our organ of medicine, that is, Master has clearly said the knowledge of physician has to be earned very clearly. And mission, we have to treat the patient very judiciously, but sympathetically also. We have to see our patient in any condition, whatever the disease may be, very cautiously. In my experience life, I will talk in another infectious disease, that is chickenpox. Everybody has faced or treat such chickenpox patient. It is also a very highly infectious disease. So at that case, what we do? We maintain some gap between these. So in this way, here we also treat our patient with maintaining such precautionary measures and advise our patients nothing to be worried. Patient would be very much, very much, very much, uh, very much noisy within self, that what would be, a fear of death may come. If we see a patient, a person has come with general body ache, no fear of death. Actually, fear of death is common to all. Nobody likes to die before the proper age. That is after it. On the other hand, a patient has come to us, body ache, unquenchable thirst, desire to take rest for a long time. What will do? We will supply, we will give to that person brahmina, low doses. In this chapter, I must say, please select the medicines in lower potency, because lower potency will not aggravate the situation, higher potency will create the aggravation, even death may occur. If we save our patient, we must follow the knowledge of potency, knowledge of repetition of dose also. Please, if there is any question, please tell me. Dear audience, if there is any question, please tell me. I am ready to prepare to give you the proper answer, whatever the knowledge I have. Moreover, I want to listen something from you.
No, sir, question and answer will be probably after finishing our session. This is my idea. Hello.
Sir,
Hello?
the question answer session will be at the end.
Okay.
Pradip sir.
Okay.
So, to the audience, if you have any questions regarding this topic, please write this on private means live chat over there, which you will see on the chat button. Just write it over there if you have any type of doubts with this topic, and we will take those questions. Means Ujjal sir will take those questions at the Q&A session. So, okay, Ujjal sir, over to you.
Dr. Doctor has told very nicely with some medicines and protocol of preventive COVID measures. I also had some things about this that it is after COVID, so many people have suffered probably really respiratory disease, cardiac problem, and also neurological problem. Due to COVID infection, some patients also develop myocarditis, heart failure, thrombosis, all this with leakage of arterial thinner. If COVID infection, the artery wall become thinner because this leakage of blood cause some this cardiac problem and also pulmonary problem. And if people also develop the neurological problem, fatigue due to neurotoxins infected in the brain or neuroinflammatory changes in the brain. Also some people also syncopal attack, all these things. Anyway, Dr. has told everything very nicely how to prevent and also told about the potency and degradation of those. Uh, I also want to add one admission that LMC also made me think with this allergic rhinitis. Along with COVID, some patients may come to us with flu-like or influenza symptoms, but we have to differentiate that flu or influenza from the COVID initially, otherwise we will not target our result. So that should be very cautious about whether it's influenza or flu or this COVID. So now rest of question will be answered later. Thanks to Dr. Datta again. So let's be welcome.
Thank you, Ujjal sir. I think Arinjit, our next speaker is in. Dr. Arinjit Chattopadhyay.
Yes,
With permission from Ujjal sir.
Hi, Dr.
With
Arinjit, welcome,
permission.
welcome.
regards to
Yeah,
both of you.
please.
Regards and respect to both of you. May I start?
How are you? নমস্কার নমস্কার
Yes,
ভালো আছো তো
হ্যাঁ স্যার আপনাদের আশীর্বাদে আপনাদের আশীর্বাদে আছি স্যার
ওকে কন্টিনিউ
Can I start, sir? Okay. First of all, let me offer my regards and respect to all my professors who has guided me to this level, whatever achievement I have done, because of their blessings, their teachings, their admiration, their encouragement, and all those things. And next, I would like to offer my humble respect to my seniors, namely Dr. Bidyut Mukherjee, Dr. Ujjal Mandal, Dr. Poloy Sharma, for their encouragement and providing me with the opportunity so that I can discuss my whatever little experience I have with all of you. And finally, I would like to offer my sincere thanks to my colleagues and my juniors, especially Dr. Orko Mukherjee, who is quite junior to me. Okay, so my topic today is various ways to approach the remedy of a case. So, am I audible? Okay, so let's start.
Yes,
Am I
sir, you are
audible?
audible.
Orko?
Yes, sir, you are audible, sir.
Okay, thank you. So, first thing, before we start to practice or prescribe anything, we have to understand the importance of pathology. Whether the case that we are dealing with, whether it is in a functional plane or is it in the pathological plane. So we will first try to assess the importance of pathology in homeopathy. Of course, characteristic symptoms are very important. Of course, totality of symptoms, metro symptoms, physical general particulars are important, but pathology is equally important. Especially, we know that Dr. Bogar, Dr. Bogar gave great stress to pathological journal. So pathology is very, very important. So let us see why pathology is important and how is it important. So pathology, first of all, we need to diagnose the case. What is the diagnosis of the case? That has to be achieved as a first instance. And why do we need to diagnose? We need to diagnose to see whether the case is a medical one, whether the case is surgical, or whether the case is of emergency origin. So why do we need to know? Because if it is a case of emergency, we will have to refer the case immediately without any delay. We cannot offer a second delay. It is called a golden period. Every single second counts in emergency cases. So we cannot keep emergency cases at least in outdoors or at home. That is the first thing. Second thing is surgical cases. Surgical cases we can keep cure certain surgical cases to a certain extent, not all of them. Say for example piles. Say for example fistula. We can cure them. Say for example hernia. But if the same hernia becomes strangulated, then it becomes a surgical emergency and the patient has to be immediately rushed to the hospital without any delay. So these surgical parameters have two things. And same is the case for medical cases. Medical cases, emergency cases we have already discussed. And what about non-emergency cases? We can handle that quite easily. But we have to understand that what are our strengths and what are our weaknesses. If we do not understand our strengths and our weakness, then we are in trouble. Okay, so this is the first point is diagnosing. The second point that we need to know that this diagnosis helps us in management and treatment of the case. How does it do? Say for example, the patient is suffering from severe diarrhea, severe electrolyte loss. So we have to provide the management. What? We have to apply the appropriate saline or appropriate fluid. Say for example, there is blood loss. We'll have to provide blood after proper ABO grouping that we all know. So this is the management part. And next comes the treatment part. Okay. Now, how do we do the treatment? That is, of course, we have to treat the case not only on its totality, but also in the pathological staging. We have always witnessed that Dr. Farrington's case. Dr. Farrington usually used to say that you will have to take the totality, but the totality should be covered in such a way that the same remedy must also cover its pathological parameters. Because if we simply cover the pathological parameter, we will lose the case. If we simply cover the symptomatic parameter, we will lose the case. But if we combine both, then success is our charm. We will get the success as we need. And next, the most important thing of pathology, we have to know the miasms. Miasms, as we know, miasm can be covered by totality of symptoms. Miasm can be covered by pathology as well. So, miasm has two parts. One is the active part, and the other is the dormant part, the sleeping part, that which is subclinical. So, the first thing we have to take, what is the active miasm? What is the active pathology? What is the active totality? What is the strongest feature of the case? Not just all the symptoms, we don't take all the symptoms, but we take the strongest symptoms of the case, and which is reflected in pathology, which is also reflected in miasm. In fact, miasm is the bridge between symptomatology on one end and pathology on the other. So this has to be understood that when we do both the things together, or in fact all the trilogy together, it comes to a given point, and that is the similima in most of the cases. Okay, next thing, not every case is pathological. There are certain cases which have functional expressions too. So when we are prescribing for functional cases, we will have to prescribe functional remedies only. When we are prescribing pathological case, we have to prescribe on pathological cases only. But pathology again has two parameters. One is reversible pathology and the other is irreversible pathology. There is not much we can do in irreversible pathologies, such as in advanced case of cancer, advanced cases of tuberculosis. We have very limited option. So in such situation, we should try and palliate the case, and with proper informing the case that this case is, from our point of view, the perspective is not that good. However, we under such circumstances can take the expert opinion of the concerned allopathic specialist also. Okay, but when the case is in the reversible plane, we have very good option. If the case is on the functional level, our treatment is the best. I must assure you. Okay. Next comes the question of how do you approach the case? How do we approach the case? How do we appreciate the case that this case has certain points of strength and certain points of weakness? How do we know? Suppose the patient is unconscious. How do we approach the case? Suppose the patient is a child. How do we approach the case? Suppose the patient is say for example, lunatic or in an unstable state of mind. How do we approach the case? Under all these circumstances, because Dr. Barnett says lunatics, liars are always, you cannot rely on them. You cannot rely on their symptomatology. So under those circumstances, we will have to rely upon our own observation, our own clinical observation upon signs. So we have symptoms, we have signs. If the symptoms are little doubtful, little up and down, we have to rely upon the signs. What is the patient gait? What is the patient's gesture? What is the patient's posture? How does he react? How does he talk? How does he behave? What is his attitude? All these things has to be taken into consideration. Okay, now let us share certain examples. Say for example, we know Dr. Enin Chaudhary's case. That is a very famous case. A patient came up, a European patient. He had a very large practice. We all know. He had a very large practice. And suddenly, a European patient came to him, a very bulky one indeed, and he just, instead of sitting on the chair, he simply collapsed on the chair. We sit on the chair normally, okay, but he simply collapsed on the chair. Dr. Chaudhary asked only 2 or 3 questions, and the case was sealed. What is the remedy? The remedy is Stanham mate. So Stanham mate does not sit down normally because of enormous weakness, tremendous weakness. Especially the weakness is in the chest. And we know the patient is of a tubercular diathesis. Stanham mate is a very strong tubercular remedy, just like caricurb and tuberculinum, bacillinum, phosphorus, drosera, and so on. Stanham mate belongs to that category. Stanham mate also has got a sodic element also. But that did not prevent Dr. Chaudhary to make a prescription. He made a successful prescription on that very attitude that the patient collapsed on the chair rather than sitting down normally. So that is a very, very wonderful observation by simply looking at the patient. Next, if you observe the facial expression of the patient, what is the facial expression? Is the patient very alert? Is the patient very dull? Is the patient very drowsy? We have remedies for each and every one of those conditions, but only thing we have to do, we have to keep them in one, so as to say, in a platform, so that we can understand and we can prescribe the remedy simply looking at the facial expression. Say, for example, patient has got edema around the lid, around the eyelids. What do you prescribe? We prescribe usually phosphorus and other that group of remedies. We have edema in the upper eyelids. What is the main remedy? Dr. Allen said, Kalyani. Okay. Then we have edema of the lower eyelids. What medicine do we have? Epismet. Of course, we do have to ask for further questioning and further interrogation. Further, if we cannot ask questions because patient is not in a position to speak, we will have to then gather other signs, other observable signs which are diagnostic to that remedy. So we have to study our remedies based on symptoms on one hand and signs on the other. Okay, let us see some other examples. Lips. Say, for example, the lips are red, crimson red. Okay, what medicines can we think? We think of tuberculinum, we can think of belladonna, we can think of sulfur. But if the patient is a female and she has applied lipstick on her lips, then the symptom is quite invalid. Okay, then you have malar flashes upon the cheeks, and you at once know that this malar flash is due to alcoholism. But if you ask the patient, The patient will say, no, doctor, I don't have those things, I don't have those addictions. But you can see the addictions right written on the face. It is, I think, written on the wall. So you can now prescribe straight away Lidam, especially if that flashy area is a bit tender. Okay. Now we have discharges. No matter where the discharges come from, if the discharges are active, you have arsenic album, you have got mark salt, you have got arum triphyllum, whole lot of remedies you have got. Okay. If the discharges are bland, what do we prescribe? We usually think of olophyllum, we usually think of pulsatilla and others. Okay. If the discharges are, on the contrary, stringy, just hanging from icicle as if, what medicine can you think? Beautiful remedy is laccaninum. Wonderful remedy is calibi. Okay. So these are the most important parameters. Next, you come for perspiration. The perspiration is very easy to detect, and you can see the patient areas where the perspiration is occurring. So you can at once understand those areas where the perspiration is visible, especially in summer weather. If you can see the perspiration in the axilla, perspiration in the forehead, scrotum album, perspiration on the tip of the nose, you know. And what is the odor of the perspiration? Is the perspiration odorous? So if the perspiration is severely odorous, you can think of bacteria, you can think of sorainum. Okay. If the perspiration is soury, you can think of rheum, you can think of calcarea. There are other remedies, but I'm telling you only the main remedies so that you can fill in the blanks at leisure. Okay. Now, what is the facial expression? As we have said, if the patient is drowsy and sleeping, coming to you and simply dozing. Okay. So what sorts of medicines can you think of? You can think of cannabis indica. You can think of opium. Even though you may notice, friends, the patient has not spoken a word, neither have we asked any question of any sort. We are yet to ask any question. Okay. Now, a very important aspect, now the patient is asked to speak. And you are asking, okay, tell me, fella, what problem do you have? Okay. Now, when the patient speaks, you will have to say, what are the complaints does he have? Okay. Now, complaints can be synchronized according to from cause to effect. Complaints can be synchronized from birth to current. We call it past history, past medical history, past surgical history. Okay. Complaints can be synchronized into family history, both paternal and maternal, and first degree relatives mainly. Okay. But there are certain complaints within the patient, within the presenting complaint, within the chief complaint, guys, that the symptoms, when one symptom is there, the other is not there. Then the other, the other is active, the first symptom is gone. We call this the alternating symptom. We often get disappointed, but why is the patient prescribing, telling one symptom, and then the next complaint comes up? And why does the second complaint comes up, and we treat it, and the first complaint returns again? So it is very disappointing. It is very annoying for us. But if we take a closer look, we will come to know that it is the same story. It is the same primary symptom that is alternating in the same patient all the while. So Hahnemann tells us you will have to take both the alternating symptoms together, and you will have to come to a single remedy. Okay, so let us take some examples of alternating symptoms. Okay, very common complaint, diarrhea. Everybody sees that, whether you are a young chap or you are a senior professor or just a mediocre like me. Everybody sees diarrhea. Okay, no big deal. But when the diarrhea occurs and you treat the patient, you prescribe according to the totality. You prescribe podophyllum, you prescribe gratiola, you prescribe aloe, you prescribe cyclamen, you prescribe whatever you can prescribe, whatever that is indicated, you can prescribe. But when you have successfully treated the diarrhea patient, comes rheumatic or joint disorders. That is very annoying. Okay, you start treating the joint disorders most successfully, and that comes to diarrhea. So in this case, we can see that diarrhea and rheumatism is alternating with each other. Okay, what are the medicines you can take? There are a lot. We can tell you only 2 or 3 common. abrotenone and calibi. Okay. Similarly, you have congestion of the head and congestion of the heart alternating. This is nothing but vasospasm because Gronoin is the remedy. Okay. And Gronoin has this vasospasm or circulatory irregularities or circulatory disturbances. We know that. So we can see that circulatory disturbances occurring in two anatomical zones. It looks apparently alien to each other, but that's not the case. You will have to come to a single remedy. What is the remedy? We know now it's Glonoin. Okay. Similarly, cough alternates with eruption. What is the medicine? Protontic. Diarrhea alternating with constipation. What medicines can you think? Abrotenum, anti-include, naloxone, sulfur, and so on. Okay. Eczema alternating with internal disorders. No matter what the internal disorder is, doesn't matter. But it has got eczema. And in that eczema, you've got a sprinkle of symptoms. Okay, what symptoms? That the eczema has got, say for example, a cracked appearance. Okay, not easy to heal. Okay, so what medicines can you think of? Medicine is graphitis. So internal disorder alternating with eczema, graphitis. Palpitation alternating with piles. Okay, what medicine can you think? Okay, so these are the few parameters that you have to keep in mind. Okay, we shall now proceed further. Now, next thing that we come to know is etiology or cause. How did the disease originate? Now, here is a trick. A cause can be a true cause. A cause can be a false one. Hahnemann said a small cause cannot give rise to a big disorder unless and until there is a big miasmatic chronic disease lurking behind. In that case, the apparent cause is a false one. You will have to look out for the true cause. But if you can find true cause, especially in acute diseases, we can make very, very wonderful prescription. Okay. Now, let us take an example. Vaccination. Vaccination occurs, we usually provide to our children. Okay. Vaccination is provided to the adults as and when needed. Okay. And vaccination, as we know, is now going on globally. Corona vaccination. Okay. So if there is any bad effects of vaccination, how do you combat it? Now, guys, you all know that Dr. Barnett wrote a wonderful book. And what is the name of the book? Vaccinosis. It's cured by future Occidental. So Dr. Barnett's idea was that vaccination causes an artificial psychosis, a iatrogenic psychosis, psychotic miasm within the system. That can be treated by Suja alone. And he has shown marvelous cases, excellent cases demonstrating its efficacy. But with the advancement of homeopathy, our stalwarts, our professors, our masters, our seniors, and all over the globe discovered other remedies as well, which we have to know. Okay, so what medicines? Let us discuss a few. Say, for example, the patient has got an allergic disorder. Okay, a sort of rash coming and going. You find suddenly the kidney is not functioning. The urine function, urinary output is somewhat irregular, bizarre. Okay, are you drinking water properly? Oh, yes, I am drinking, but I don't know why my urine output is not that good. I feel that my urine output is not that clear. I'm having issues in my back. I don't know what it is. I don't know what it is. I've done my X-ray. I've done this and that, but I can't figure it out. What is happening? So you have kidney disorders, you have allergic disorders, and if you make inquiry further, the patient is touchless. If you inquire further, the patient has got constipation. What is the remedy? Everybody says, okay. What is the next medicine? Say, for example, the patient has got allergic eczema. And if you trace back and back, you find again the vaccination is there. What medicine can you think of? Upeksha. You can prescribe that and you will get wonderful result. Okay. Severe reaction after vaccination. This is happening in various COVID cases all around the world. You can, if you simply turn around and if you look into the newspapers and media and all those things, you suddenly figure it out. We have a wonderful medicine to combat that. What's that? Vaccination. Okay, prescribe that and you will witness the wonder. Okay, next medicine, you have got post-vaccinal eruption, but without allergy. Without allergy. What is the medicine? Medicine is Kalyani. So you can see simply by looking into the vaccination and its effects, we can make wonderful prescriptions and we can make wonderful success and good name for homeopathy. We can do it. Okay. Next, say for example, patient is having vertigo. So doctor, I am getting vertigo. Okay, when do you get vertigo? No, I don't know what it is. I don't know. Okay, so now you realize the patient has got a malar flash on his cheeks. But it is not a Didampal case. Don't jump into conclusion. It's not Didampal case. Okay. What is the medicine? Colocynth, natural nursery. Wonderful. If you all you have to do is to compare between these three, ask a question or two, and you're on. Okay. Mental agony, tremendous mental agony, tremendous tension, tremendous anxiety, and that reflects into sciatica. Severe sciatic pain. More the anxiety, more the sciatica. Okay. Okay. You have got in Dr. Oscar Borik's repertory two medicines, aconite and arsenic album. But if you go to William Borik, you will find yet another, spiky lesion. So this is the beauty of homeopathy. So simply by witnessing the etiology, simply by trying to elicit the true cause, not the false ones. Don't get misled, guys. Once you witness the true cause, you will get tremendous results in a very short span of time. Because if you're seated on your OPD, you have a large span of patient, large number of patients awaiting at the outdoor, and you will have to see all of them. We don't have time for extensive case tagging, extensive repertorization, extensive thing. We will have to make snapshot prescription. And those such snapshot prescriptions will work if you know how, when, and where to hit it. If you can hit it, we can hit it with precision. It is something like precision guided missile. That is homeopathy. Homeopathy is nothing but precision guided missile. But you have to know how to operate the missile, how to hit the target, which missiles to select, and why. We have tons of missiles, but we have to select the missile which will hit the target. Okay. So these are few examples. Now let us come to specificity of seed with Dr. Barnett. Strongly recommended specificity of seed. Dr. Bonington told it as location, and Dr. Barnett also said organopathy. What is the seat of the disease? Dr. Bogar said seat of the disease. The same thing, location. Okay. Suppose you have a patient comes to you and tells you, doctor, I have a tremendous backache. I can't move. It goes off and on. I can't bend forward. I can't move sideways. I can't walk properly. I can't cook because in these rural areas they cook by sitting down on the ground. We can't go to the bathroom because they don't have proper bathroom in all over all the places. But most of the places now government is trying to make normal bathrooms. So people are being discouraged to go to bathroom to open places. That's okay. But patient is having severe backache. Now you start palpating the spinal region. You start from the lumbar region, then you ascend to the dorsal, then cervical, and at certain point, patient says, "Ouch, doctor, ouch! Please don't do that." So that is the tender point. Okay. Now you order either X-ray, CT scan, MRI, and you come to the conclusion the patient is either having spondylolisthesis, spondylosis, or slip disc, PIPD, prolapse of the intervertebral disc, or PID, whatever you can call it. So that is the diagnosis. That is the reason why he or she is having backache. Okay. Now, when you have this sort of cases, do not expect homeopathy to do everything. You will have to, homeopathy will do, no doubt homeopathy will not do, but you will have to take certain accessory measures, accessory steps. What are the steps? You will have to ask the patient to prevent from stooping, ask the patient to ask the patient not to carry any weight, so that the particulates do not undergo undue stress. Okay, you will have to ask them to do physiotherapy. You will have to ask them to wear braces. Okay. Now, what are the medicines? The patient has done everything. Now, it is your turn to prescribe. What are the medicines that act upon the spinal cord location? Okay. You can think of agaricus. Very wonderful nerve remedy. You can think of zinc metallicum. Okay. You can think of phosphorus. You can think of silicea. You can think of silica marina. So, host of remedies are there. I'm mentioning only a few. Okay. Now, patient has got pancreatic disorder. Other symptoms are there, but those are really vague, and you don't have proper modalities on concomitants, so you will have to make something else. But what you do know, the pancreas is at fault. Okay, then amylase lipase is high. Okay, patient is having acute abdomen off and on. Okay, and to make matters worse, suppose patient is alcoholic. The disaster for recipe is complete. Okay, what medicines can you think? Atropinum, wonderful remedy. Iodium, iodine source, phosphorus. If you go to Buri, medical, no big deal. Okay. Medicines acting upon the intestines, arnica, belladonna. But if there is intestinal ulcer, carivi, okay, arnica gallon, okay, marcor, plum balm, especially when there is stricture, okay, uranium nitrate, other symptoms should be there. So these are the group of remedies that you can think of, and one or two further questioning will seal the prescription. No big deal. Say, for example, the patient is suffering from splenomegaly, splenic disorders. What other medicines can you think? Cyanosis, of course. Agaricus is there again. Arsenic album is there. Belispar is there. Calcarea ars is there. Chininum sulf is there. A lot of other medicines are there. Okay. Next, we come to the sensations. Now, sensation is a cheeky affair. When we think of sensation is a delusion. But there's a trick up the sleeve. What's that? Sensation can also relay a preclinical state of affairs. Well, actual pathology is yet to come, but the system is providing a warning that I am under stress. SOS. Please help me. How's that? Say, for example, patient is getting an uneasiness in the epigastric region. Not that much. Gone to this doctor, to that doctor, or done all sorts of investigation, done all sorts of tests, ultrasonography is done, this done, that done. Nothing is found. And the doctor said, "Oh, don't matter. It is a matter of you're having flatulence, and just rectify your diet. Don't take that food. Don't take this food, and do this and that. Take these medicines. I'm getting you multivitamins and this and that. Go home. You'll be fine." After a while, what happens is patient gets hepatomegaly. The patient gets gastric ulcer. Patient gets diaphragmitis. You see, all are related to the epigastric region. But at the time of investigation, even though those investigations and tests were done by specialists specialists, very reputed specialists. They couldn't find anything. But now the patient comes to you complaining that I have got this and that problem. Now the diagnosis has appeared. You will have to treat the patient. So what do? We have now to take the symptoms or the sensations that has occurred long, long ago. So these preclinical symptoms should now corroborate with now pathology at the place or the anatomical region. It may be liver, it may be the stomach, it may be whatever, it may be diaphragm, it may be the spleen, whatever. It may be the pancreas even, rarely. So you will have to take that preclinical state into current clinical state, see the common remedies, and you will have a common prescription. You will have to come to a prescription. So sensation is something that should not be neglected. It should not be thrown away. If we do that, we homeopaths are making serious mistakes. We shouldn't do that. So let us have certain examples of sensation. Say, for example, the patient has says something is coming up. Doctor साहब कुछ ऊपर आ रहा है, पीछे तो ऊपर है. Something is coming up, but I can't tell what it is. Okay, it may occur as globus hystericus. It may come from the lower limbs. It may come from the forearms, anywhere. So we have ascending sensations. What medicines can we think? We can think of asafoetida, we can think of pipersal, we can think of moxol, we can think of phosphorus, platina, and so on. Okay. Now the patient has, say for example, another set of patient is complaining of faintness, unexplained faintness. And there have been situations in patient's life that he has actually fainted. And he has gone from pillar to post from all the doctors across the country, and nobody could determine anything because there is nothing. But the same faintness can later on be a neurological disorder, a psychic disorder. Okay, it may be a cardiac syncope. So you can see the sensation is gradually moving into a pathological state of affairs. So we will have to prescribe. Even though that very sensation may not be present at this pathological stage, it may have occurred long, long ago. Dr. Lipi's case, some of you must be knowing that the patient has had diphtheria and tonsillitis, sore throat, I suppose, if I'm not wrong. This case was reported by Dr. Wieselhoff. And that sore throat occurred from right to left and back and forth. That was long, long ago. But now the patient has got erectile dysfunction, sexual debility. We use a homeopathic term, and the medicine term is erectile dysfunction. He has got seminal loss and all those things. So even though, says Dr. Wieselhoff, that he didn't know that the patient, that the remedy that was prescribed had ever had anything to do with erectile dysfunction, yet Dr. Lippi prescribed it. Now, what was the remedy? We all know, black caninum. And we further said that this patient may require pulsatilla, but the patient never actually required pulsatilla. Black caninum took care of the case. So this is the significance of past clinical history or preclinical state, to be more precise. The preclinical state is very, very important, which is sensation. Okay. So what are the remedies? Aconite, arsenic album, hipersal, naxomoxeter, naxomica, plumban, porphyrin, etc. There are many, but I'm saying mentioning only one or two, very few. Next, the patient may have a floating sensation. Parts are floating. He himself is floating, as if he's leaving the ground and as if levitating on the air. What other medicines can we think of? Naxomoxeter, sticta. Sensation as if limbs are frozen. And if you examine those parts, if you examine the patient saying that the parts are frozen, he feels like that. That is a sensation. But if you touch the part, you can also feel that the part is actually cold. Peripheral vasoconstriction with the sensation of icy coldness of the limbs. What medicine can we think of? Agaricus, nitric acid, Heloderma horridus. Okay, take the other way around. Sensation as the limbs are burning. You may say, oh, that's nothing. The sulfur is there, securigon is there, mesorenin is there. But that is sensation. But what about if the burning parts also feel hot to you? If you touch the part, it will also feel hot. What is the medicine? Robin Murphy, guaiacum. Okay. So we can now see the importance of sensation. How can sensation help us? Why do we need sensations? We cannot just throw it out because it's a delusion. We don't do that. Okay. Next, we come to the chapter of modalities. Modalities are very, very important. In fact, they are the defining factor of homeopathy. They are the so as to say, signpost in the middle of the ocean. If you don't have modalities, you have nowhere to go. In fact, had there been no modalities, there would have been no homeopathy. Okay. So let us consider the modalities. Aggravation first. And in aggravation, we'll take the time factor, the time modality. We may not go through all the medicine, but we will touch a few. Say, for example, the aggravation in the morning. What medicines are there? Ammonium is there, argentum nitricum is there, arsaid is there, auromate is there, which is also aggravated in the night. Bryonia is there, to mention a few. Next, we have aggravation in the forenoon. Cannabis sativa, natrum car, natrum podo, to mention some. Now, say for example, the patient has got forenoon aggravation, but not of everything. Patient, unexplained irritability in the forenoon. Now, irritability can be due to cause, any cause that the patient may have. But when the cause is inapparent, there is no rational explanation to that aggravation in the form of modality in the forenoon. What medicine can we think? The medicine is manganum aceticum. Of course, other symptoms must corroborate, including pathology. This point cannot be reinstated. Okay, cannot be re-emphasized, the importance of this. Next, say for example, we have forenoon cheerfulness, nothing to account for, no reason for it. In fact, Dr. Tyler says that if the symptom has got accountability, then throw that symptom to the dustbin. But if the symptom has no accountability for it, rest assured you have a gem. So cheerfulness in the forenoon, Pipermethysticum and Comocladia dentata, wonderful medicines. T.F. Allen. Okay. Aggravation in the noon, all complaints aggravated in the noon. Argenta metallicum, Nux moschata, valeriana. Boninghausen. Aggravation in the afternoon, alumina, belladonna, calinitricum, calivi, to mention a few. Evening aggravation, ammoncarb, ambra, arnica, arsenic, pulsatilla, cyclamen, calamine. We know that. Okay. Aggravation in the night, aconite, arsenic, album, chamomilla, to mention a few. Okay. Now, very important and interesting aggravation that we will discuss now. What's that? This is seasonal aggravation. If anybody wants to make a snapshot prescription, that also seasonal, especially in a very busy clinic. And say for example, the symptoms are not that clear. If the symptoms are clear, we must prescribe that medicine. But if the symptoms are vague, undefined, not clear, okay, maybe this, maybe that, what do we do? So Dr. Bogar has written a wonderful book, Times of Remedy and Moon Phase, where you find seasonal aggravation. We will mention some example from his book. Okay. So spring aggravation, antim-tart, calcita in general, no matter what the complaint is, especially if it is a chronic complaint, you can think of antim-tart, calcita. There are other medicines also, but these are the main ones. I'm telling you the main. Okay. Lacus is also there. Springtime coryza, acute rhinitis, running of the nose. What are the medicines? Ilium cepa, gelsemium. But let me tell you again, guys, that if you get clear-cut symptoms of any other remedy, you should go for that. But if it is not, then we can think of these recommendations. Okay. Often you will find these medicines are indicated. Okay. Next comes springtime cough. Very unusual medicine, Pradip album. Nobody thinks of Pradip album in an acute condition. Springtime diarrhea, more unusual medicine, lachesis. This was from Dr. Herring's recommendation. Summer aggravation in general. Okay, Calibi, Ethusa, Belladonna, Brynia, Naxomica, etc. But in the summer, suppose the skin complaints are aggravated. In other season, it may or may not increase or decrease. But in the summertime, skin complaints are invariably worsening. Calimue. Complaints aggravated in the autumn. What medicines can we take? Antimtar, Rostock, China, etc. There are others as well. Okay, but in autumnal diarrhea, colocynth, iris burs, and ipecac leaders. There are others. Complaints aggravating in the winter: aconite, amoncar, brynia, carbovage, okay, chamomilla, dalcamara. These are the few. Okay, but in the winter, which is upcoming now, you have aggravation. You have cough, acute cough, aggravation in the winter. Chamomilla, calimere. Joint disorders aggravated in the winter. Prostocks. Skin complaints aggravated in the winter. Alumni is there, Nux mortuaria is there, petroleum is there, tuberculinum is there, and others are there. Sorinum is also there. Okay. Now, aggravation according to situations and circumstances. Right? Now, aggravation from brushing the teeth. We are taking certain random examples. Aggravation from brushing the teeth. What medicines can we think? In Allen, it is written carbovate. There are others. Coccus cacti, Chavishagia. Some of them. I'm mentioning only some of them. Okay. Now, the very, very, very unusual aggravation. But if the patient keeps steady in a perfect position, as is transfixed, there is nothing. But if he changes his position to the slightest, any slightest change of body position, the complaints erupts to its violence. What medicines can we think? Capsicum, euphorbium, peramid. Okay. Complaints aggravated in the clear weather. We have got causticum, we have got brynia, we have got pipersa, we have got naxomica. Clear fine weather, crystal clear weather, complaints aggravated. Nothing to account for it. Complaints aggravated closing the eyes, no matter what the complaint is. It may be headache, it may be acute abdomen, it may be the diarrhea, it may be vertigo, whatever be the complaint. Complaints aggravated closing the eyes. Brynia, lachesis, sepia. Complaints aggravated combing the hair. What medicine can we think? Brynia, selenium. Okay. Complaints aggravated grasping anything. If you simply grasp, or if the patient grasps someone or something, or somebody else grasps the patient, touches the patient, or say, for example, supporting the patient, especially if the patient is paralytic, which is quite normal. Or paralytic patient who is partially paralyzed, the patient may be helped by the relatives. Okay, but the complaints aggravate. What is the medicine? Wonderful, wonderful. Homeopathy is beautiful. Okay, now we have got amelioration. Very interesting. In amelioration, again, we will consider time. Now, this amelioration according to time is very rare. Very few medicines are there. Now, say for example, amelioration in the morning. All complaints are ameliorated in the morning. Chelidonium, muriatic acid, zinc, recommend. Amelioration in the forenoon. Again, alumina, zinc comment. Amelioration in the afternoon. All complaints are ameliorated, in the afternoon. Natam subsifia. Complaints ameliorated in the evening. Calibi, Calicarb, Oramu, Natronatam, Ignitia, so forth, so and so forth. Amelioration again according to situation and circumstance. Very, very interesting. Bending or turning the affected part ameliorate. If you turn the patient, so previously we are seeing that any change of position aggravating the complaint. Now we are saying the bending or turning the affected part amyloid. Very, very interesting and amusing symptom, wonderful symptom. If you find it, simply majestic results. Belladonna, China, chamomilla, that is from Bonnie Houston's therapeutic pocketbook. Holding the breath amyloids, excellent, excellent indication. Now, if any of you have gone through Phatak's repertory introductory part, Dr. Phatak's repertory introductory part, he has given a wonderful case of thrombophlebitis obliterans or Pradip disease. The patient, as usual, is having gangrene, having severe burning pain, and the patient is literally tossing about from pillar to post. Nothing is ameliorating, but only one ameliorating factor was there, holding the breath. If the patient closes his nose and mouth and stops himself from breathing, his complaints are ameliorated. Can medicine was or is belladonna. Beautiful result. Holding the breath. So we can see that belladonna, we all know, is an acute medicine, but it has got a chronic expression. So acute medicine may have a chronic expression. Similarly, a chronic medicine may have an acute expression. Now, let us see about Natramur. Let us take some example. The Natramur, we know, is a chronic medicine, no doubt about that. But if you go to William Borwick's Materia Medica chapter notes, you will see it has got complaints starting with sneezing, acute running of the nose, infallible. When the acute rhinitis starts with sneezing, and he even mentions the potency, Natramur 30th potency. Try it. So we can see that a chronic medicine has got an acute expression. Again, we go through Hippar-Sulph, and again to the chapter of nose, we will see that Hippar-Sulph can cause drainage of mucus from the nose. Which mucus? From the sinuses. So obstructed sinuses, maybe acute, maybe chronic. Especially staph coryza is there. Hippar-Sulph will initiate it, but we all know Hippar-Sulph is a chronic medicine. So an acute medicine has got chronic expression, a chronic medicine has got acute expression. Dr. Sarkar repeatedly told us about it. We will have to take a note about it, and he is a genius. He tells us that these sort of things are there. Only thing is we have to figure it out and pick it out. Okay. Next we have amelioration from yawning. All complaints are ameliorated by yawning. Very strange. I have never had this modality, this patient, any patient having this modality, but it is there. Medicine is Staphylococcus. Amelioration by vomiting. Coccus cacti, digitalis, secalicore, sanguinaria, to mention a few. Okay. Amelioration by rigorously shaking the head. Lactovirosa sina lachesis. Now concomitant symptoms. Concomitant symptoms, again, or associated symptoms. We are running out of time, so let me go fast through it. Mental symptoms associated with cold feet, whatever be the mental symptoms, whatever be its gravity, whatever be its significance, whatever be the diagnosis, whatever be its pathological stage, if the mental symptoms are associated with cold feet, you can go to Bogart-Bonnickerson characteristics repertory. You will find there graphitis is mentioned. Of course, other symptoms must collaborate to the medicine. We cannot prescribe on single medicine. That thing is very important for us to notice. But graphitis is the medicine. Mental symptoms alternate with physical symptoms. Aconite, Argenta metallicum, arsenic, calcarea, cicuta, chamomilla, to mention some. Vertigo associated with atrophy. Causticum, indigo, lachesis, viscamalgam, to mention a few. Brain complaints associated with severe convulsions, epileptic convulsions, plum vomit. If you go to Oscar Borick's repertoire, you will find it. Brain complaints associated with cough. Medicine is Glonoine. If you go to Fatak's Media Medica, I suppose Fatak's repertoire also, you'll find it. Eye complaints with nausea, no matter what the eye complaints is, with nausea, Asarum europeum. Now, let us come to the mode of onset. How does the complaint start? Okay. First is sudden onset. Let us consider a few cases of or few medicines about sudden onset. Sudden causeless anger. Patient is getting angry, suddenly angry, but without any cause, without any apparent or known cause. What medicines can we think? We can think of phosphorus, we can think of stramonium. We have to compare the two, and we are there. Next, we have got biting, suddenly biting. Phosphorus is there. Okay. Ruta is there, cannabis indica is there, to mention a few. Headache increasing suddenly, decreasing suddenly. Asafoetida, calculaca, fluoric acid, pulsatilla, of course, belladonna is there. Gradual. Mode of onset is gradual. Head pain increasing gradually. Hippocampus, lactua virosa, and carbovage, to mention a few. Okay. Next is duration of complaint. How long has the complaint started? What is the duration? Acute alcoholism. So you must have heard that a youth suddenly into a wrong place with perhaps the wrong company, and he drinks wine. He is not addicted to it, and he suffers the consequences. Apocyanum opium. Acute mania. Cantharis gelsinium, to mention a few. Any mental symptoms that are acute in onset. Don't bother what it is, but all you know it is an acute onset of mental symptoms. Coffea, opium, ruta, vanilla, to mention a few. Acute depression. Not severe depression, but acute. The onset is acute. The medicine is carcinosin. Acute inflammation of the eyes, Euphrasia hydrastis. Acute diarrhea, well, we know that. Aconite is there, Isusa synopium is there, aloe is there, podophyllum is there, pulsatilla is there, cyclam is there, a lot of medicines are there. Acute tonsillitis, Elianthus, Apis, Baptisia, belladonna, a lot of medicines are there. Glycyrrhizia, glabra, gymnocladus. Okay. Subacute complaints. Subacute complaints, say for example, subacute hepatitis. William Boris Media America, phosphorus. Subacute conjunctivitis. Boris Media America, pulsatilla. Subacute gastritis, Clark's dictionary. Arsiod. Okay. Chronic vertigo. Cyclical phosphorus conium, to mention a few. Chronic grapharitis, alumina is there, Argentina aticum is there, graphitis is there, Alicia is there. Okay, let's mention a few. Now, complaints followed by. So, fear followed by diabetes mellitus. Okay, what is the medicine? Pain-grinding symptoms, opium. Exhilaration followed by exhaustion. Great joy, having a party, enjoying with your friends, just enjoying oneself. And with exhaustion. What is the medicine? Tiafalin, clematis. Complaints preceded by perspiration, preceded by headache. Ferrament, Lycopodium natrum, to mention a few. Coma preceded by vertigo. So the patient is now suffering from coma, and on inquiry you find the patient had vertigo. before the onset of coma. Ascutus glabra, T.F. Now let us mention certain pathological clues. Okay, cirrhosis of liver with biliary vomiting, curare. The same medicine that has got respiratory paralysis of the respiratory center with diabetes mellitus, of course. Conjunctival atrophy, Argentina nitricum oram, fatty degeneration of liver, Dr. Barnard's favorite, vanadium, William Boris America, manganum aceticum, and from Dr. Kent, lactidiflorton. Gout with head complaints, all pathological affairs, colossus and axomica. Okay, now let us mention certain clinical. Vestibular syndrome, Corbo animalis. Flower-Vincent syndrome, Cadmium metallicum. Adams-Stokes syndrome, Reserpinum. Nephrotic syndrome, Oram uniatom, L serum is there, Apis is there, Calcarea ars is there, Natrum silicum ureticum is there, carbonic acid is there, calichlor is there, lot of others. Okay, hyperlipidemia, Chelidinium, Conium, Hydrostress, Lecithin, Taraxicum. Yes, Oram uniatom, of course, also. CA brain, Paratacar, Barata, iod, plumbum. One should not forget Caliphos 6X. CA lacrimal glands, Corbo animalis, severe burning associated with. CA nose epithelioma, arsenic album, hydrostis. Now, this hydrostis is an interesting drug. Hydrostis can be prescribed according to Dr. Clark for any cancerous condition. Okay. Now, prescriptions based on constitutions and temperaments. Hydrogenate constitution is synonymous to psychotic miasm. What are the medicines? Canania, diadema, dalcamara, meroinum, natron. Okay. Thuja, of course. Lithymic, where the patient has a tendency to form stones here and there. Thyroidolithiasis, nephrolithiasis, then cholelithiasis. So, lithymic constitution, anti-influent, calcarea carb, formic acid, formica rufa, guaiacum, to mention a few. Neuropathic, nerve lesion, okay, ignitia naxomica. Oxygenoid, synonymous to syphilitic miasm. Oxide, ferramide, cariide, syphilinum, Maxwell, Oramide, to mention a few. Carbon nitrogenate constitution, cuprum, sulfur, solanum, synonymous to Sora. Uric acid diathesis, Epigia, Ichthyolum, Artica urens, to mention a few. Scrofulous diathesis, tuberculinum, Scrofularia nodosa, Oram, Mark Binard, Mark protoiod. Okay. Now, prescription can also be based upon family relationship. Dr. Clark has recommended it in his repertory, of the clinical materia medica. And he mentions that family relationship is very important to make the second prescription. And work is in progress at the moment from Dr. Rajan Shankaran, Ian Shelton, and others. We are working internationally to prescribe remedies or to find out themes on which you can prescribe from family relationship only. Genus, species, orders, subspecies, class, subclass, this, that. You can prescribe from that. That can be done, provided character symptoms are there. We can prescribe on, of course, no source, sarcos, and imponderability, especially when the case is very difficult, very obscure. The other day we were seeing one of Dr. Sarkar's case, and he prescribed epilobium over there. CA larynx, perhaps involving the epiglottis too. And there we found that he has prescribed adenocarcinomatous nosode after epilobium. So that was a very instructive case. This also occurred in CME of ours. You can take a look if you want to. Okay. So now we can see that if we venture to look around, and if we keep notes about our findings in these headings that we have said. There are many others, mind you. I couldn't say to you so many things in a short span of time, but there are so many things that we can venture, we can look out, we can tabulate, we can jot it down. We have materia medica, we have repertories, we have therapeutics. So one thing you must understand, materia medica is just not a set of books, a set of symptoms. It's just like a friend. We can come out from the books and shake hands with you. Hello, doctor. How do you do? Good morning. Good evening. How can I help you? Materia medica is a personality. Every remedy is a personality, whether it is fully approved tier A, whether it is partially approved tier B, or it is rarely approved or rarely used tier C. Whatever be the tier of the medicine, every medicine from every authority has its clinical value, whether we can recall it or not. What we need to know is to tabulate it in a proper place so that we can prescribe it quickly in a short span of time without wasting too much time. Because we have so many patients to look. Of course, there are difficult cases. Of course, there are complicated cases. Of course, there are cases that are very obscure. Those cases have to be repertory. Those cases have to be looked into. We have to consider the repertory. We have to go to the Kent's Materia Medica. We have to go to synthesis. We have to go to radar. We have to go for other software. We have to go. But that does not mean every single case you do like that. It's not needed. Even Dr. Sarkar does it. He said it. And even in our class, he said it. That is not a mistake or a blunder. Especially when the cases are very difficult. But if we tabulate our remedies, if we simplify the remedies and classify it accordingly, we will make very quick and rapid prescriptions in a very short span of time. Okay, thank you very much. Thank you for a patient hearing. I think, I don't know whether I've exceeded the time. Orko, are we done? Orko, please come in.
Yes, thank you so much, Arinjit. I'll request Orko to bring up Ujjal sir on screen. Yeah. It's your turn, Ujjal sir. And we
Thank you, Arinjit. Thank you. Are you audible? Yes.
Close
I'm
the
audible.
audio part which you are seeing on the from
I'm
any other
audible.
YouTube one. It's echoing very
I'm
much.
audible, Apu.
Ah, you are audible now. It is echoing too much.
Okay, okay, okay. So, okay, okay, okay.
So please do
Very
some
nice
meaningful
presentation by
part.
Arinjit. These are very vast topics, but he has to finish with the limited period. One thing I just before he starting his topics, he discussed on the diagnosis of the diseases. As he told that some diseases require immediate attention. So he told that suppose one example is given this in case of hernia. Before diagnosis, we have to send the patient to the emergency immediately. But we should not allow patient to go up to the establish. Before establish, we have to send patient to the proper hospital for treatment. Because if it is not young in adult, it is rarely is a recovery with homeopathic medicine. So for my knowledge, so as because the inguinal canal become relaxation, so it will not be cured by homeopathic medicine. And he told some diseases like vertigo. He told that also the diagnosis is required and also randomly is important for diagnosis. Suppose if a patient is having vertigo and he has a vertigo cervicis spondylosis, so in this case, management also is important. He told something about highlighting that some sensation, protein sensation, other sensation, we have cited some medicine I also want to, as per water repertory, some more medicine is given there. Extolana, Lactanina, Viscous Selva, Zinca, Carbohydrate, all this. Anyway, thank you, but it will be more better if this presentation was in PowerPoint, then it will be very helpful to beginner who was who are joining this session. Thank you, Dr. Ranjan, dear Doctor, and thank you, Dr. Arinjit. Hope next time we will do better.
Thank you, sir.
Thank you.
One question suppose as post anyway, because one question has been posted in the mobile was so
Who's the question? Sir, please advise medicine for excessive hair
There
loss
is
and
a question.
okay. Please advise
Yes,
medicine for
please,
hair
please.
loss and excessive working, lean, hardworking girl, 17 years old. After a few months having COVID, food taste and smell, with selective food. Okay. Uh, Dr. Art Chuck, I suppose. Yes. In this case, you have got a lot of symptoms. So don't be worried about whether the patient has got COVID or not. You will have to simply cover the symptoms. You will have to simply cover what are the totality of the symptoms on them and what are the signs. You have posted certain symptoms, I think, but you will have to repertorize it. We can't prescribe just like that. Because excessive hair loss is a common symptom, I suppose. Girl, yeah, there are hardly any symptoms, I suppose. So you will have to go for further symptoms, further information you have to gather from the patient, and you have to see what are the medicines that are coming clear to it. But if you have vague symptoms, you cannot prescribe upon them. You have to figure out the characteristic symptoms of the case. That is the most important thing.
Right, there might be some internet issues with Arinjit. Anyway, now I'll request, there are no further questions. I'll request Kalyani sir, please, as we all are here, Dr. Datta might have left. Also, is Dr. Pradip Ranjan Dutta there?
Still, I'm on the desk. Bidyut, I'm here.
Okay.
Hi,
Over to you, Kalyani sir. Over to
thank
you,
you.
Kalyani
Many,
sir.
many thanks to all. Many, many thanks to all of you. Especially, we are very, very happy for Dr. Upeksha because she is now a very potential torchbearer in Sri Lanka.
Thank you, sir.
Thank you very much. Carry on. Any help from our side, you are always will be very happy. And one
It's so
request
nice
to
to hear
you
from you.
to please convey this CME information to all of your friends and all alumni in Sri Lanka by which they can come forward as a speaker. Many,
Yeah, I
many thanks.
already did. I already
Thank you
did.
very much. Thank you. Just inspire them to provide their experiences to us. Okay.
Yes, sir. I'm trying my level best to do that.
Thank you very much. Thank you. Carry on. I'm very happy that you have taken that responsibility of uh, holding the torch of homeopathy in Sri Lanka. Then I must thank Dr. Ujjal Mandal. He is always with us, always, since very beginning. Pradip Ranjan Dutta, my classmate in Calcutta Homeopathy College, and he tried to focus the tradition of Calcutta Homeopathy Medical College. That means ignore diagnosis, concentrate on symptomatology and prescribe.
Thanks,
Uh,
Kolani. Thanks,
there is a
Kolani.
reason because when we started learning in Calcutta Homeopathy College, our teachers were at least 20, 25 years before they studied homeopathy. At that time, your paramedical subjects, anatomy, physiology, then your pathology, etc., was not that much sincerely cared for because at that time academic training was not that much sharp. So
Exactly.
anyway, but what you have experienced that ignoring diagnosis, definitely homeopathy can proceed, but if we can diagnose by achieving knowledge on anatomy, physiology, pathology, and medicine, progress and success are definitely much more than less knowledge on the paramedical subjects that we have experienced. So we must diagnose the cases for management, for prognosis. Patient will always ask,
Sure.
and we have to at par with the modern system of medicine, that we are learned, we are qualified, we know the scope and limitation of our system.
Exactly.
So thank you, Arinjit Chattopadhyay. Very nice collection. He has given a long list of interesting symptom and its medicine. He has given a
Thank
list
you.
of single-legged table, starting
All
from
because of your
present,
blessings
complex,
and your
location,
lecture.
sensation, modality, concomitants. All chapters he has covered nicely. But we must be very careful that single-legged table, detection of medicine by single-legged symptom means single symptom is risky. Definitely it is
Well,
helpful when there is no other way out. Only one symptom uncommon, there is no other thing, then that is the only guideline, and these drugs give immense help. There are separate books, there are combined books like a repertory where you will get all these informations. Nicely he has given examples to encourage us for looking on this subject. That means we should not be very casual to take the symptom. Where the uncommon peculiar symptom lies, that you have to bring it out. Then you search the books. Separate books are available on sensation, on modalities, then in location, causes, and everything. And nicely he has proceeded, as we have the subheadings of presenting complaints for acute disease specially, that is onset, duration, location, sensation, modality, concomitants, and other characters like radiation, characters of the discharges, your coordinated symptoms, etc. What is my opinion that, and you must agree with me, that to begin the homeopathy system of medicine, we are sure to tackle with this type of prescription, means short snap prescription. One of our teacher used to call it as bathroom prescription. Just example, somebody was taking bath in the bathroom, and one family member asked, the child has fallen down and he is crying, there is bleeding. What medicine should be given? From bathroom, we can safely say arnica, start with arnica. Then another family member told me, suddenly he was all right, he was playing. Suddenly there is temperature. So without asking any symptom, we can ask from bathroom, give aconite. This is very essential, because if we do not succeed at our home, at our own circumstances, family members and society, where we belongs to, by the short snap prescription, from this only we start our practice. That means family members, relatives, surrounding people, they will gradually, slowly develop confidence on your bathroom prescription, means short snap prescription. And we do not restrict on the short snap prescription, gradually proceeds on symptom totality, presenting complaints in all fragments, then we become a good acute disease prescriber. Then after becoming acute prescriber, after passing graduation, gradually proceed towards sub-acute prescriber. Definitely beginners, interns, or very beginner practitioners. Paralysis patient will not come to him. Heart attack patient will rarely come to a beginner. Serious disease patient, really chronic disease, suffering for years together, moving from one to other doctor, they seldom comes to a beginner unless they are compelled by financial constraints or other constraints, social constraints. So then we become gradually subacute prescriber. Then with the subacute prescription, we gain confidence on family members, relatives, patients, society. Gradually become chronic prescribers, and ultimately, in latter part of the life, we find that patients are coming from different homeopathic doctors too. That means then we are become really constitutional prescription, rare prescribers, obstinate diseases. So these are the steps gradually. So Orange's presentation is nice, very beautiful. That will definitely encourage all of us that we should not neglect these type of symptoms when we are studying, because sometimes these symptoms will give you immense help. But we should not forget that simply depending on this symptom for an subacute or chronic disease is very risky. There we must try our level best to find out at least three-legged table, minimum three symptoms. If more than that is welcome, very good. When it is very much striking, clear cut, then we can directly prescribe. When it is clumsy, symptom totality, then we can refer to repertory as per necessity. Symptom totality means subjective or objective symptom totality more. We can go to Bonning Hoshen. Clinical symptom, pathological symptom more. We can go to clinical repertories. Constitutional symptom, mental symptom, past histories, and other your general symptoms, physical and mentals are more, then usually you go for Kent repertory. So these are the usual steps. So thank you to all of you who have participated as coordinator, inaugurator, speakers, viewers and listeners. Thank you very much. Please inform us good speakers by their telephone number. We will contact them. We always want to improve our CME by which it must have a minimum standard, because we want to keep the name and fame of National Institute of Homeopathy much ahead of our expectation by altogether efforts. Thank you very much. Many, many thanks to all.
Thanks, Kolani. Thanks. Thanks.
Thank, thank you all, and humble appeal for all the viewers. We had started our benevolent fund during pandemic, and it's been immense help for the alumni who are in need, who are in distress. And a committee has been formed under chairmanship of our President Kalyani sir, and from various parts of the country, the people are recommending the account number. Excuse me, the account number of Punjab National Bank is already in the description. So all the alumni, please donate as per your wish, and do the membership renewal. It's only 100 rupees per year, and it started from 2010. Those who are yet to do their membership, just count the number of years you had passed from 2010 and count, multiply by 100 and transfer that money in the National Institute of Homeopathy Alumni Fund. Thank you. And with permission of Kalyani sir, I think we have our next CME on 12th of December. Uh, Upeksha, we are expecting a lot from your team, and Arinjit, as we are hoping you will be transferred from North Bengal very soon to other
Thank
part
you.
of South Bengal. So
Thank you.
please inform the other alumni in touch with you to be a speaker, as Kalyani sir had already requested to all of us. And with this, we are returning back to the backstage editor, Orko Mukherjee.
Thank you.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME, and if so, please do make sure to like this video, also the live stream part. Please like this, share this to your fellow alumni, fellow homeopath, and fellow medical students or medical friends which you have with you or you know. And also, as being requested before, if you know any of the alumni to be a speaker, or you are an alumni who want to be a speaker in our show, please do be in contact with Kalyani sir or with the Mukherjee, with any of you know. You can get in contact with the Mukherjee or Kalyani sir. Do make sure to get in contact, and also to get updates on our further future CMEs, please join our Telegram channel. We have a Telegram channel, yes, and the link is given in the description below. Also, if you want to get updated on future CMEs, so and other updates on NH and NH alumni associations, so do like our Facebook page and follow us on Instagram and Twitter. We are very much active over there too. Also, we gives updates over there, so don't don't forget to follow over us over there. So thank you again, and if you still didn't took auto-generated participation certificate, do what are you waiting for? Just go click on the form link given below in the description. Just click on it. You have to go through some formalities. Just do it and get your auto e-generation certificate. So with this, thank you all. Good night to the live viewers, and also thanks for watching to the video ones. We will see you in our next CME. Until then, goodbye.